All right, today we're diving into a story that's right at the crossroads of cardiology and rheumatology. It is a true medical mystery, a coronary drama that was absolutely not what it seemed on the surface.
So I want you to imagine this for a second. You get this crushing chest pain, the kind that sends you straight to the ER thinking the worst. The doctors, they run every test you can think of. But what if the problem isn't your heart at all? That's the exact puzzle we're going to try and solve today.
Okay, so our story today centers on a patient whose case, and I mean this, baffled physicians for months on end. So who are we talking about? Our patient is a 51-year-old woman, and she's dealing with this intense, recurring chest pain and shortness of breath. Now, there's another key detail here, something that seemed totally unrelated at the time. She also had pre-existing hearing loss. Keep that in mind. And look, this wasn't just a one-time thing. We're talking about an 8-month-long ordeal. Can you just imagine the frustration? Going from doctor to doctor, landing in the ER over and over again, and still, no answers for this awful pain. And here's where the mystery really kicks in. Every single time doctors looked for a heart problem, they came up with nothing. I mean, all the standard cardiac tests, totally normal. Her symptoms were screaming heart attack, but the evidence just wasn't there. So, as you can imagine, this sent her medical team into a total diagnostic maze. They had to look beyond the obvious and start a much, much deeper investigation. Okay, before we go any further, let's quickly define a key term you're going to hear: vasculitis. Put simply, it's just inflammation of your blood vessels. Now, when they get inflamed, they can narrow or even close off completely, and that cuts off blood flow to the organs they supply. It's a really serious condition that can affect pretty much any part of the body.
All right, back to the investigation. The team did everything by the book. They did a left heart catheterization. Nope, no major blockages. They did an echocardiogram and her heart was pumping perfectly fine. A normal ejection fraction, that's just a measure of how much blood the heart pumps out with each beat. And her troponin levels, which are a huge marker for heart damage, also normal. It was a complete and total dead end.
But then, they found a critical clue hiding in her history. The patient mentioned that on previous ER trips, she'd felt a little better, just for a bit, after they gave her steroids. Now, since steroids are these super powerful anti-inflammatories, this was the first real hint that maybe, just maybe, the problem was inflammation, not some kind of blockage.
And that one clue, that was everything. It pushed the doctors to look at the problem from a totally new angle, and it led them to a scan that would finally blow this case wide open.
Yeah, after 8 long months of searching, a different kind of picture was about to reveal the truth. A sophisticated CT angiography, which is basically a scan that lets you see the blood vessels in detail, it finally gave them the answer they were looking for. And what they found was, well, it was just jaw-dropping. 13 millimeters. That was the thickness of the wall of her aorta, the main artery coming right off the heart. Now, to put that into perspective for you, a normal aortic wall is only about 1 to 2 millimeters thick. Hers was severely, dangerously inflamed and swollen. So you see, the problem wasn't a simple clog in a pipe. The inflammation was affecting the entire highway system of her body. Her aorta, the major branches going up to her arms and her head, and even the very beginnings of her coronary arteries, they were all inflamed. And that explains her chest pain. The blood supply to her heart muscle was being choked off by all this inflammation. Okay, so now they knew what the problem was, this severe inflammation of the aorta, or aortitis. But the next big question was, why? What was causing it? And believe me, the answer was something nobody saw coming. The culprit turned out to be a rare disease, and it was acting in a very unusual way. The diagnosis? Granulomatosis with polyangiitis, or GPA for short. But this wasn't your run-of-the-mill GPA case. This thing was a true master of disguise. And here's the big twist, the reason this was so hard to figure out. See, GPA typically attacks the small blood vessels. We're talking about the ones in the sinuses, lungs, and kidneys. But in this patient, it was attacking the large vessels, like her aorta and coronary arteries. It was behaving just like a different disease called Takayasu arteritis. And that's what made the diagnosis so incredibly challenging. So just how rare are we talking? Well, a review of the literature found that out of 101 patients with this type of vasculitis, only 5, just 5 of them, had this kind of large vessel involvement. That's less than 5%. This case was quite literally a needle in a haystack. So how did they finally nail it down? Well, they used a diagnostic scoring system. It's kind of like detective work with points. A positive blood test, the CANK test, gave her 5 points right off the bat. And remember that hearing loss from her history, the thing that seemed unrelated? That added another point. That brought her total score to 6, which is well above the 5 points needed for a diagnosis. Boom, GPA confirmed. Just a brilliant piece of medical detective work. So, with a firm diagnosis finally in hand, the team could stop investigating and start treating. And this led to a really remarkable recovery and, some powerful lessons for everyone involved. So, what did the treatment look like? First, they started her on high-dose IV steroids, which helped with the pain almost immediately. The initial plan was to use a drug called rituximab, but she had a bad reaction to it. So, the doctors had to pivot. They switched her to a combination of 2 other drugs, cyclophosphamide and avacopan, and after about 12 weeks, they were able to transition her to a long-term maintenance therapy. So, the big question? Did it work? Oh yeah, absolutely. A follow-up scan about a year later showed that the inflammation in her aortic wall had gone from a critical 13 millimeters all the way down to 6. That's more than a 50% improvement. Her symptoms were gone, she just responded incredibly well. So what's the big takeaway from all this? Well, this case is just a powerful reminder that rare diseases can be masters of disguise, right? They can look just like much more common conditions. It really highlights why doctors need to keep an open mind, especially when all the standard tests come back negative. And maybe most importantly, it shows that even in these super rare, tricky cases, getting the right diagnosis and treating it aggressively can lead to fantastic outcomes. And that really leaves us with a final lingering question, doesn't it? When doctors are faced with a medical puzzle like this one, how many other mysteries out there are simply rare diseases in disguise? It's a question that really pushes the boundaries of medicine every single day.